The heat wave that is gripping much of eastern Canada has turned deadly. Public health officials say at least 6 people in Montreal have died of causes related to the extreme weather. With the humidex there, it feels like it's in the mid-40s in some spots. Montreal's public health director saying people who suffer from chronic illnesses like diabetes and heart disease can be particularly vulnerable.
Since the weekend, we had, unfortunately, 6 deaths related to heat, and all deaths are investigated. So we found that most of them were people living alone. Most of them had a chronic disease or mental health problem.
Dr. Zach Levine is an emergency physician at the McGill University Health Center. He joins us now from Montreal. Thanks for your time.
My pleasure. Thanks for having me.
What are the health conditions that are made worse by the extreme heat and humidity?
Well, there's certainly a few risk factors for people getting any kind of heat illness. The ones that we're seeing very commonly are people with heart disease, people with diabetes, and respiratory diseases. So people are having a lot more trouble breathing because of the hot air, the humid air. We're seeing a lot of people with that. And then, in addition to or prior to getting heat exhaustion and heat stroke, a lot of people are getting lightheaded. So your blood pressure drops and you feel like you're going to pass out. Those are some of the common things that we're seeing right now.
If you're a caregiver for someone who has chronic illness, what should you be looking for? You mentioned, for example, someone who's lightheaded, maybe dizzy. Would they have a faster heart rate? Would they look flushed?
Yes, exactly. So early on, heat stroke is sort of the one end of the spectrum. That's a really life-threatening condition. But before you get there, usually people have a few symptoms that you can watch out for. And of course, we can talk about if we have time, ways to prevent. But basically, the things to watch out for are, like you said, rapid heart rate, profuse sweating, red, warm skin, nausea, dizziness, lightheadedness, all those things can be some of the symptoms people are having when they're getting to a dangerous point and they really need to be cooled down urgently.
All right. So if you are overheated, and I hope it's not a silly question, would you have a fever? Would taking your temperature help?
It's not a silly question at all. And the body is actually very good at regulating temperature within a pretty set zone. So in general, no. One of the definitions of heat stroke actually is once your temperature actually gets high, up to over about 40 degrees Celsius. But up until that point, the body actually does everything it can to try and cool down, including obviously sweating. Sweating being the big one, and also our veins and blood vessels dilate to try and dissipate the heat. But the problem is when it's so warm and when it's so humid, the sweating and evaporation doesn't work as well, and so our body mechanisms sometimes fail, and that's when we get into trouble. So unfortunately, temperature isn't something you can check, but like you said earlier, heart rate is something you can check. If you're able to check your blood pressure, if you have a machine, that's another thing that we watch out for. So low blood pressure and high heart rate are good indicators that someone is becoming dehydrated. And that's one of the most important early signs that someone needs to be hydrated quickly and cooled down.
You mentioned prevention, so let's talk a moment about that, because the obvious advice is stay somewhere cool, go somewhere cool, and make sure you keep hydrated, drink lots of water. Beyond that, is there any advice you can give?
Like you're saying, there's no secret here. The problem is not everyone has the same access to coolness, so not everyone has air conditioning. So one thing you can say is try and get to a place with air conditioning, like a public place, like a library, like a mall, something like that. There's a lot of public pools around here that are being kept open late so people can get to them. In addition to that, if you don't have air conditioning, go to a shaded area. You want to wear cool, light, and light-colored clothing that's not too tight, and things that breathe, so cotton as opposed to some kind of plasticky something that will keep the heat in. And then, yes, you want to try and hydrate yourself as much as possible, so try and drink as much fluids as possible, not alcohol, not caffeinated beverages, because those actually are not great at hydrating you, but hydration is very important. And then if you can get wet somehow, so if you can spray yourself with a little bit of water, if you can get a fan to try and increase the evaporation to increase that method of cooling your body, that's helpful as well.
All right, Dr. Zach Levine, got to leave it there. Thank you for joining us on the program.
Thank you.